Hi, I'm Dr. Bill Adams, and it's my pleasure to be moderating this Sientra Enhanced series on CVD-19 Crisis Management series. Obviously, this is unprecedented times. We are dealing with things that many of us never even thought were possible a few weeks ago, but now we're in the middle of it. And so this series is going to be looking at three separate areas: the crisis intervention, and then CVD-19 data and important information for practitioners. And then finally, we're going to talk about taking the lead back for your practice. And there's nobody better to help lead us and guide us through this than Sandy Roos, Sandy, and it's great that we have basically a skeleton crew of one person here, and you and I are 6 feet apart, social distancing, but we're really trying to get this information out quickly, and you're somebody that's been doing this for so many years and given me such great advice and many practices. Sandy is really an expert in implementing strategies for aesthetic surgery practices. She has over 30 years of experience in plastic surgery, internal medicine, and cardiology, and has been doing plastic surgery consulting for 18 years. Sandy, thanks so much for coming, and I think there's a lot to talk about.
Absolutely. Thank you for having me.
And there's a lot of ears that are listening, because these are times that most of us have never seen anything like this before. There's a lot of people that are apprehensive, they're scared. And I'm not talking about just the general public, I'm talking about plastic surgeons,
Absolutely.
And so, the first thing we're going to talk about is really this crisis intervention. But can you just give us some recommendations and guidance on, like, okay, we've got a big problem right now, and what are we supposed to be doing as the person that's supposedly leading their practice?
Absolutely. They are tough times right now. And I have the opportunity to talk with a lot of surgeons throughout the United States. And the one question that I'm hearing over and over again is, what can I do now? And we're going to talk a lot about that throughout the series. But I think one of the most important things that you can do now is just truly be the leader. You really need to set the tone for your practice. It's important that you continually communicate with them and try to maintain a level of professionalism, first of all, but also making them feel really good about themselves and their jobs and really where the country is going at this time. So often when I work with practices, the communication part from the plastic surgeon to the staff sometimes is not done very well, but this is the time to be the leader, and this is the time to set the tone. And again, I always tell practices, I don't mean to make light of it, be very positive with your staff, and if you really need to panic, just give me a call, and then we'll kind of talk about that. But it's important just to really keep a positive attitude for your staff.
Yeah, you've given that advice just in general about a lot of things that we do, and I think it's very good, because a lot of times surgeons get disassociated from their practice and they don't really serve as a leader. But now I think you're exactly right. People, you got to put on your big boy pants or big girl pants and be the leader, because your staff is, all this uncertainty makes them scared and makes them uneasy about things. But you're the person that they're looking to.
Absolutely.
All right, well, that's great information. And I know that through this series, we're gonna give people specifics about how they really can be a leader through all this.
Absolutely.
But there's some immediate things people are concerned about in terms of many of my fellow plastic surgeons, and there have been hundreds, or literally probably thousands of questions I've seen in the past week. But talk to us a little bit about the initial financial moves that people can do, things like their vendor payments, their credit card payments, their rent, malpractice insurance.
Absolutely.
Can you give us some guidance on that?
I can, and this is one of those areas right now that I, like everybody else, is really waiting for something to come from the White House and some type of legislation that's really going to help with the small businesses. I'm keeping a close eye on that, because it affects so many of the plastic surgeons that I work with. But in the meantime, until that is passed, because I'm almost positive it will get passed, I think it's important just, again, to have communication with your vendor. Don't ignore them. Reach out to them and let them know, this is my plan. I'd like to be able to give everybody just this is what you should do, but every practice I work with is in a different financial place. As well as most practices at the end of December, that's when they really kind of clean out their bank accounts. And so the first 2 months of every year, things are just a little bit light. Well, this is a really bad time for the economy to be happening. So some of the surgeons, they really don't have, any extra funds right now. Some of them do. So again, maintain communication with your vendors, let them know what you can do right now. I think we heard some really great information from your webinar that you did on Thursday night, reaching out to, I think one of them gave the example of like to American Express and saying, can you, extend me 60 days to not have to make a payment? And they said they're very good about that. So again, it's about communication. I'm hoping again with this legislation from the government that there will be help with the rent, everything to be able to maintain your practice. And that's really all I can say at this point, because every single practice is different.
Yeah. And same thing, I guess, with malpractice insurance,
Oh, yes.
perhaps potentially discussing that with your carrier. I think the message that I'm hearing, and the experience of people that have done this, like Dr. Canales last week on the Aesthetic Society webinar, is that sometimes people think, oh, there's nothing that can be done. But when you just make a call and talk to whatever it is, you'll find that there are quite a few businesses and people that support you that are willing to help.
And give them a plan, like what you can do as well. I think that's what they really appreciate, not saying what can you do, say, hey, this is what's going on and this is what I'm able to do.
The second big thing that people are struggling with is just their employees.
Yeah.
So walk us through some of the options there. People talk about, oh, I need to lay my employees off, or I need to furlough them. There's a lot of different options.
Correct.
Some, obviously people have huge practices with many employees. It becomes very complicated. But give us some pearls and recommendations in terms of your employees.
And again, that's a tough one. And I am getting a lot of calls on that as well. There are some states that already have some programs that are just for their states. And I know surgeons in those have already laid off their staff. For the majority of the practices that I work with, they really are saying, I'm going to pay them through the end of March 31st. And at that point, depending on where they are financially, that they will allow them then to use their PTO. I have quite a few practices though that don't have the funds to even maintain or continue to do that. And unfortunately, they're in a tough situation. I have not met one practice that says that I want to lay off my staff and they're happy about it. But again, it's communicating with your practice. I feel through this that it's important that you keep your key people in the practice, your lead team, the people that are answering the phones, because you want somebody to be answering the phones, communicating with all of your patients, so they should be working. The one where I see the most that people are challenged with is what do they do with the nursing staff, because they really aren't generating revenue and they don't have patients coming in. I know you've said that you have, at least in the interim, that certain nurses or people will be in the practice on different days maybe to see follow-ups and post-ops. And again, it's one of those situations that it truly is practice specific, but again, it's having a plan and communicating it with the staff.
And many of the states have had even provisions now that say that unemployment benefits for, say, an employee that's let go would be immediately available. Correct. But then a lot of surgeons have asked the question, well, what does that mean? Like if I have some people that get let go, but then I'm obviously keeping a core group, but what does that do to my unemployment rates? And what are the financial repercussions of that?
Correct. Well, and we're hoping that again, that there's a lot of this will be answered in the legislation. But to me, one of the things, and I thank you for asking that because I should have brought that up, is that a lot of practices, not all of the employees use the health plan that the practice offers. And so some of them, if you lay them off and they are under your health plan, they no longer have health insurance. And so some of us, with some of the practices, we're really looking and taking a deeper dive in to see which makes sense for the staff as well as, for the practice. Because you don't want them to be without insurance. And again, this is the worst timing right now because we just don't know. But as far as, laying them off, sometimes it is going to give them benefits that they wouldn't have otherwise. And there's certain states like up in the Northeast that they have great unemployment benefits, and some of the staff would probably do pretty well on that. But again, I'm just hoping for the legislation to come out to give us some more guidelines.
And in terms of what does furlough mean? What's the difference between laying off and furloughing an employee?
So a furlough means that you are temporarily not working. You think of it like when the government, they have a furlough their employees. They aren't working, but once things come back, they are hired. But the difference is with the government, when they're furloughed, they get back pay. And so that's where, we have to be really careful when we look at the complete definition, and I haven't looked at it completely. But that is the difference. A furlough, I think you're guaranteed your job when you come back. But I know some of the guidelines that I've read so far through some of the states, and Illinois was one of them, where they said that you can lay your employees off and they qualify for this program, but only if you agree to hire them back.
Right.
And so I feel like the unemployment insurance will be handled a little bit differently through these times. But again, it's state by state, and there's nothing that's been, nationalized yet.
Yeah, and you mentioned that it's so dynamic. We're here today. Literally within the next hour or two, that something could change. Correct. You mentioned the Small Business Administration. that has existed for a long time. But your recommendation, as the time we're shooting this, is that people should wait until we know exactly what all the different relief packages are.
Correct. And there is a couple relief packages that I've seen, and it's interesting because I had a practice says, well, we're going to go ahead and apply now for the emergency funding through the Small Business Association. And I was like, well, can't you just wait 2 days? And I read to them some of the programs that are going through the Senate right now, and all of them say that you do not qualify if you have already applied through this other program. Mm-hmm. So it's important to really wait to see what's going to happen, because there really are a lot of great programs that I think are going to benefit practices. And it truly is this, you're going to be able to take a deep breath and okay, we've got this now.
Right. The last part of this first segment on crisis intervention is, not only we need to keep in contact with our patients and things, and we'll talk a little bit about in the second section about policies and things, but we want our patients, number one, need to hear from us. They need to know what were our responses to this problem. And if they need to come in the office, they need to feel safe that we're going to do that. And we'll get to that. But what about, what do you recommend in terms of practices and staying connected with their patients?
Again, it's all about communication. And right now, I think it's important that you know how to communicate with your patients based off of demographic. So if you have that younger age patient, the younger demographic, they're going to communicate more through texting or through social media. But if you have more people in my age, we read email still, and we actually go on Facebook.
Right.
And so you want to make sure that you are communicating in all of the avenues that you have available to reach out to your patients, and not just choose one over the other.
Right.
As well as really laying out a plan and not just relying on your staff to remember to do what they need to do and how they need to communicate with them. Be very specific, put a plan like this is what we're going to do on this day, and, week 1, week 2, and which days of the week, what are you going to communicate, and who is that going to be to?
Right. And they always say that 1 minute video is worth a million words.
Correct.
And so video remains the conduit that patients want to connect with.
Correct. And I just love, Bill actually just showed me not too long ago what the Plastic Surgery Channel has done and what you have done specifically, and it was great. That was an amazing message. I was like, oh, who can I send that to? Mm-hmm. So great job on that.
Yeah, thank you. Okay, and then in terms of this initial part, again, having a plan is key. Correct. If you don't have a plan, it never works out. So setting a plan in place, how you're going to deal with this initially, as we've talked about, and then moving forward and then exiting this. That's what we'll talk about the rest of the time. But maybe Sandy, talk a little bit about, everybody talks about virtual consults. It's kind of the catch term, like I'm going to do virtual consults, but there's more to it than just saying you're going to do it, right?
Absolutely. And this is actually one of my key initiatives this year, was really talking with my practices about doing virtual consults and doing them well. An interesting piece, though, is that when I was talking with Bill Fukui, he's one of my marketing people that I work with a lot, he had said that even though we call it virtual consults, people Google online consults. And so that as you're marketing, you really want to make sure that you're saying online consults, mm-hmm. Because that's what people are looking for, and even more so now. So yes, we want to offer this to our current patients, but we also want to take this time to making sure that we're putting it for our future patients as well. I've had practices for many years that have been doing the virtual consults, and some do it really well, some don't do it very well. The ones that do it very well have a plan in place. And where I see where most practices fail is that they don't treat it like a real consult. They just treat it as it's a virtual consult. Mm-hmm. And what I mean by that is really actually doing a little bit more than we do for a normal consult. I'm all about that pre-consult education with the patient. And so having the patient, fill out the history form, having the patient coordinator do everything that they would normally do prior to them coming in, educating them on the procedure, giving them an idea of the price, being very specific on what photos that they need to send in. The coordinator needs to make sure all of that is complete even before they get on the doctor's schedule.
Right.
And then where I see a lot of people fail, and again, when I do my weekly calls with my practices, is that it's a virtual consult and they're like, oh, I have to call them back. Don't end the consult with the doctor. The next part should be the coordinator now speaking with them about the pricing just as you would in a normal consult. And so really taking this time that you have to make sure that you're doing it correctly, because you will need it now, but more importantly, you're going to be able to utilize it in the future, because it is something that people want to do. We did a study, I know this is kind of off topic, but there was a study done last year and we were talking about virtual consults and we were trying to see who was doing it, and we were shocked at the end that it was local patients were wanting the virtual consults. It wasn't out-of-state patients like we had been seeing over the years. So through this, we were like, why we have to be better. So take the time now to get it done right so you can then, take advantage of it when you come back.
That's really interesting. And it's probably something that people could, once they get this set up, they'll be able to use it as time goes on. Now, in terms of that online consult, do you have any recommendations in terms of should people be using some sort of visual platform? You could certainly do some of the things you talked about and just have a phone call, but it's probably you have more connectivity. And do you have any recommendations about that?
I always try not to make recommendations because then I'm talking about one company and I don't like to do that. There are many platforms out there, but you have to do one what's best for your practice, and one that you're comfortable with. And there are many, like I said, I just don't like to promote one over the other, because there's a lot of great platforms out there right now. And I could definitely talk to people off, but I just want to do it now.
And that's good information. I mean, I think most people are familiar with there's like probably 10 different things you could use, and I think and for sometimes it just has to do with maybe your internet connection and other things work better. One works better versus another, and that's something that people probably should figure out on their own. Okay, and then the final thing I think is really as part of this, kind of talk to us a little bit about so we're setting up a plan, but the plan's got to deal with the present now, but there's also a future, so the plan's got to kind of plan for the future thing. So what should we be thinking about? Well,
and again, we're going to go into a lot of this in the next piece, but I'm just going to take us back to 2008 and 2009 just a little bit. I really don't think I don't think it's the same. In 2008 and 2009, that was a housing crisis, but doctors were still able to operate and generate some revenue. That's not where we are today. But I can tell you the practices that did very well during that time period and came back much quicker had all of the processes in place, meaning from that very first phone call, how are we talking to them, tracking each point of the patient's decision-making process. That's what I've been preaching for years. Really taking this time right now to make sure that you have all of that done. We're doing webinars, Sientra, we offer webinars to our Sientra practices, and they're amazing. And use the time now that you're paying your employees, have them either go to the archived ones or look at the ones that we're going to be doing and continue to educate them. This is the time to prepare for when you come back. It will make a difference. So don't just let your staff sit there. If you're paying them, let's make it work for the future.
Yeah, that's, I think, incredibly good advice. So, okay, well, I think those are some great pearls, and I think things that people will find quite useful. And then the next segment, we're really going to talk about this coronavirus, important data people should know, and how to implement an office strategy.
Absolutely. Thank you.